Planning for a surge starts well before the actual incident itself. In our case, we've had surge plans for a number of different years. We test them in a number of different ways, and we revise our plans after each of those experiences. In this particular case, we looked at the possibility of a COVID-19 related surge way back starting in December. The changes that occur during a surge is simply making sure that we have staff where we need to have it. We have equipment, supplies, and in this case, personal protective equipment especially. The purpose of a tent being placed in a hospital is A, part of their surge plan or part of the community's surge planning. Number two, the tent itself, whether it's one or several, can be used for multiple purposes depending upon that plan. It could be simply used as a waiting area to overflow into. It could be used as a triage area, so some of that function comes out of an overcrowded emergency department. And in other cases, it can be used to provide actual patient assessment or patient caring. What we're in right now is what we call the Western Shelter. It's a fancy tent that we've had since 2009 when we began to have our surge planning for SARS. In this particular configuration, as you can see, it's full of chairs, somewhere between 3 to 6 feet apart, because this is right now designated to be our emergency department waiting area overflow. If the patient volume is such that there's not enough chairs in the waiting room inside, then we'll redirect those patients, some of those patients, to wait out here instead. If the volume also gets so great that the emergency department can't see those patients in a relatively short period of time, then what we will do is use this as a waiting area to feed into our alternate emergency department set up in the ready room. Well, welcome to the inside of the ready room, where we have it right now organized in a number of different ways. For example, over here we have 4 of our mass casualty portable transport litters. Adjacent to them are 2 of our Ebola supply carts that we would roll into our biocontainment unit in the facility for a highly infectious airborne disease of that magnitude. As we come over here, this is a replication of one of our biocontainment unit patient rooms. This allows us to do training of our biocontainment unit team without taking part of the emergency department out of play 4 times a year, and train with a similar degree of realism. As we walk deeper into the ready room, you can see that we've set up a number of patient assessment stations. Each of these are similarly composed and would have a clinician seeing a patient, doing the appropriate interview, a portable computer at their side to be able to make the documentation, to do whatever testing is necessary under the circumstances, and then they would be finished and would be discharged in the area that we just came through. Over here is the final part of the ready room. By its name, we need to be all hazards ready. And so while we reconfigured this room from what it's normally like to be COVID ready, we have maintained some of the other essential elements that would allow this hospital to respond to an emergency. Enhanced communication with our radios, our ChemBio response packs with our powered air purifying respirators. We even have access to our radiation monitoring and detection gear as well.